All right. Well, hello, everybody, and welcome. We're really excited to be here today. Have a wonderful team of presenters for our first coffee talk titled Reaching Families Through Telemedicine, Vanderbilt's Early Assessment, Intervention, and Part C Mentorship Program for ASD. So we're really excited that it's April, even though sometimes it doesn't feel like it's April. We don't really know what month it is, but it is Autism Acceptance Month. So we're excited that you're joining us here today for that reason. Just a really quick note on technology. As you may have noticed, we are in Zoom webinar format, so everyone should automatically be unmuted. This is a coffee talk, so we like it to be a discussion. So once the presenters are done presenting and there's time for discussion, we'll make it so that everyone is able to unmute themselves and talk. So we'd really encourage you to talk with us that way, or you can also interact via the Q&A or the chat box. So here, this is just the layout that you should see. There's the chat, raise hand and Q&A. If you're having any technology issues or need some assistance unmuting, you can raise your hand and we'll assist you there. So really quick, before we jump in, I know that sometimes we have some new people who are unfamiliar with our organization that's hosting this. So super quick, I'm just gonna run through. So we are the Association of Maternal and Child Health Programs, or you can call us AMCHIP. And we envision a nation that values and invests in the health and well-being of all women, children, youth, and families and communities so that they may thrive. I've also included our mission here, and the primary members that we serve at AMCHIP are leaders and staff from state and territorial health agencies, as well as all the partners who are vital to implementing programs to improving the health of women, children, and families, including those children with special health care needs. So we're really excited to be hosting this, and specifically at AMCHIP, our State Public Health Autism Resource Center is an online resource center. We hope that you've had a chance to check out our website, and we are hosting a series of coffee talks. We'll tell you more about the other three after our wonderful presenters today. So I will turn it over to Jeff Hine to present. Thank you.
Hi, everybody. Good afternoon, or I guess good afternoon for most of us, I think. Happy Autism Acceptance Month. Real privileged to talk with everybody today, as privileged to be a part of a panel with some really great folks to share a little bit about our telehealth program. As I'm searching how to share my screen here, I think I can do it. Believe in myself. Y'all see that okay? Okay. As I said, I'm Jeff Hine. I'm a psychologist and the director of primary care outreach here at the Treatment and Research Institute of Autism Spectrum Disorders at Vanderbilt University, Vanderbilt Kennedy Center. It's a mouthful, I'm sorry. Again, excited to be joined by great folks today, Mary, Katie, Karen, and Jamie. It might be nice just to spend just a few seconds apiece just introducing ourselves at the top, I figure. I know our panelists here will be speaking a whole lot more and can introduce and fill in more information about themselves here in a second. But Mary, if you wouldn't mind just starting off here.
Yeah, so I'm Mary Fleck. I am the West Tennessee Early Intervention Coordinator for TRIAD and overseeing our expansion into East Tennessee.
My name is Karen Olson, and I work for Emory Valley, which is out of Oak Ridge, Tennessee, but we serve counties in the East Tennessee area.
Hi, and I'm Katie Wood. I also work for Emory Valley Center, and I'm an early interventionist there.
Hi, I'm Jamie Sharp. I'm actually a parent, and Katie is our early interventionist with Emory Valley for one of my children.
All right, thanks, guys. Again, we're gonna hear some perspectives and hopefully have a good conversation with everybody. my job is to get out of the way as soon as possible here. So we're going to be just reviewing a little bit about our Teleservice program and how we work directly with our Part C early intervention services here in Tennessee. It's just this program is one example of many ways that we've partnered with our state agencies and community organizations to improve diagnostic and follow-up services and treatment services for children with autism and their families. This program is a result of a long partnership with the Tennessee Early Intervention System, which is our Part C system within the state, which is also part of the Department of Intellectual and Developmental Disabilities. Again, it would be wonderful if it was conversational today. The chat box blinks, and as I said before we started, I'm not very good at attending to it. So if there's any questions throughout, please just ask. For all our programs, we have some guiding questions that we're always asking, and the Teleservice Model is one of these programs, in how we try to figure out how to best provide quality services in underserved or rural or low resource communities while still optimizing innovation and efficiency for sustainable programming. And how do we best embed these programs in sustainable systems, but also existing systems, medicine, education, and care. So our objectives today, as I said, is to share a lot of perspectives from our early interventionists that are joining us, and as well as Jamie, our parent, about their experiences with our telehealth programs. But Mary and my job is to provide a little bit of context to that first. And so I'll give you a little bit of history, but as I said, hopefully get out of the way so we can have some real discussion and let the real stars of the show talk as much as possible. Our partnership with TEIS, again, which is our Part C system here in Tennessee, started around 7 years ago, if I'm doing the math right, 2014, with direct caregiver follow-up post-diagnosis for families, working directly with families receiving a diagnosis for autism. Since then, we've had TRIAD early interventionists work directly with Part C or TEIS early interventionists and working with families directly. That has involved professional development, some teleconsultation, working and building capacity up within our developmental therapists and other therapists working under TEIS. Some of that, I'm sorry, I'm forgetting to hit the buttons here, the slideshow. Some of that has involved curriculum development and working on family priorities for children with autism. But in 2017, we also started a Tele-Diagnostic consultation program, and I'll be sharing a little bit more about that today. And Mary will kind of talk a little bit more about how we expanded that more so to follow-up services and across our state. So specific to our Tele-Diagnostic consultation service model, we started in West Tennessee, but again, have since expanded across the state. Many families, Vanderbilt is the primary diagnostic center for our state. And while it doesn't take that long to travel north to south, it does take a long time to travel east to west or vice versa. And many families are traveling many hours to be seen and waiting months and months to be seen by a specialist at our developmental center. And so we started working with a regional health center in West Tennessee, providing some of those services to families via telehealth. Our Tele-Diagnostic program was designed to streamline care in an efficient manner, rapidly and accurately identify ASD or clearly rule it out for many kids, especially when it was a clear and pressing issue for families and they were comfortable with that setup. But again, it was not always, this type of telehealth service is not for every family, not for every kid. Again, families were always offered a choice, whether it be before the televisit or after the televisit, to be seen in person. And of course, this teleservice is not for every kid, especially those that maybe are presenting with more complex health history or social history. The way that our Tele-Diagnostic program works now is that, again, families are already enrolled in our state's Part C early intervention program. Concerns for ASD were identified and working with the parent and the child through those home visits. Families are then put into kind of a flow sheet of concerns to figure out whether or not a Tele-Diagnostic appointment would be appropriate for them. And if so, our Tele-Diagnostic Evaluations involve a number of things, one including the screening tool for autism in toddlers, which is a level 2 interactive measure that we use to highlight important social communication behaviors in young children. In addition to during that appointment, we do a record review, a caregiver interview, other informal observations as needed. We always save time to try our best to give clear feedback and a clear roadmap for next steps. For many families, and Jamie, Karen, and Katie will be talking about this more, as well as Mary, that involved home follow-up. And again, we'll be talking about our post-diagnosis follow-up program over telehealth a little bit more as we go on. For those of you interested in the specifics of the model and the outcomes, again, we don't have time today, but there's a couple of recent reports that we've been able to show some of those outcomes. Generally speaking, we're finding it's feasible and valid to do an abbreviated autism evaluation process over telehealth. Families are preferring it to do telediagnostic services rather than traveling long distances to see us. We're able to increase the number of families we serve. We're decreasing wait times, hopefully saving families time and financial costs, and for the most part, being able to plug them into priority or critical services earlier than we would have been able to. But as many of us are experiencing, all of you are experiencing COVID, and what can we do now that again our original model was with a TRIAD early interventionist working with the family directly and the psychologist remotely joining that family. But when COVID happened, we no longer were able to have a developmental therapist and early interventionist such as Mary work with the family, and so that brought up some interesting pivot points for us. So I'll talk a little bit about what the process looked like now. Luckily, a year or so prior to COVID, we had already been developing here a tool or assessment tool to be used specifically or explicitly over telehealth. And we were doing that for many reasons. First and foremost, we don't always have a provider on the other side working directly with a family, and it would be helpful to have a tool to be able to have families or have the appointment mediated by parents. So this tool, the Tele-ASD-PEDS, is designed specifically for telemedicine-based appointments. It's nice because we've designed it for open and free use. The website here at the bottom, I encourage you all to visit if interested. We've got webinars and a manual now that kind of walks providers through how to use this tool over telehealth. It's all free and open access. Again, the materials that we use are not copyrighted. We want to make sure that parents have the materials available, but also different providers as well. We've made it as brief as possible to make sure that providers can get a good look and families feel like we're seeing the behaviors of concern. But also that the play procedures aren't necessarily strictly standardized, and that a novel user could use the toys around their house, around their clinic, and we could walk them through some of those steps, still get a valid assessment. Again, the big difference between our initial model and our current model is now mom and dad or another caregiver are in charge of the assessment, right? And I'll be excited to hear kind of perspectives of Karen, Katie, and Jamie here in a second about how does it feel to be in that position, right? As we're making decisions and talking about concerns while still parents are playing with their kids. And so the difference here is that the parent is walked through the play tasks rather than another doing those play tasks, all still remotely observed and served by a remote psychologist via telehealth. We learned that we've, of course, spend more time preparing and orienting families to this process because we don't have that provider on the other side. And that involves a lot of information ahead of time about this is what the visit is, this is what it's going to look like, but also spending time, hopefully at the beginning of the visit, to orient parents about who I am, why I'm bossing them around to play with their kid in certain ways, what observations am I making, and what are the potential outcomes of this. We also want to be very clear with parents that we know at the end of this appointment, we might be able to decide whether or not a diagnosis of autism spectrum disorder is appropriate or not. And if so or not, what are some clear next steps that we can help with? Again, the real disadvantage or the real advantage of our initial model was that oftentimes we had an early interventionist working directly with the family, and that warm handoff was very warm at that point. because that developmental therapist worked directly with our early interventionists. But we're still able to have early interventionists join us via Zoom. And again, Mary will be able to talk about what that handoff looks like for follow-up services a little bit more specifically. Again, I'll point folks to these outcome papers here for those that are interested in kind of the specifics of what we were measuring. But in terms of provider use of the tele-assessment tool, but also family perspectives, we are able to gather some data. Generally speaking, provide comfortable completing these types of assessments over telehealth, feeling more and more comfortable making diagnoses over telehealth and providing feedback to families. Families also have been telling us they're comfortable playing with their child, even though they were being watched by us. Again, we'll get some more direct feedback on that today. Also, we try our best to make instructions easy to follow, try to make it as a flexible, the tool or the observation period be as flexible as possible. Families were telling us it takes about the right amount of time. They were okay with this talking about diagnosis through telehealth and having their child assessed that way. And that for the most part, that the provider was able to see most of the behaviors that parents were worried about. So some of just the general outcomes that I wanted to share to give you all some context today. And now hopefully pass it over to Mary to talk a little bit about our follow-up services. Let me stop sharing.
Yes, I will share mine,
Okay.
Oh, hang on 1 second here. Okay, is that sharing correctly? All right, so following participation in either the traditional or the Tele-Diagnostic Evaluation, families that are referred to us from Part C are offered the opportunity to participate in our 6 follow-up caregiver education and support sessions that are guided by a TRIAD consultant. These consultants have training in behavior analysis, communication disorders, and/or early intervention. Getting a phone call. Importantly, families are offered follow-up services regardless of the evaluation outcome. So whether or not the child gets a diagnosis of autism or not, they still are offered this follow-up service. Prior to COVID, follow-up sessions occurred mainly in person or sometimes using a combination of in-person or telehealth, depending on the family's interests, their location, and their access to technology. Currently, all of our follow-up services are being provided through telehealth. The follow-up services are also provided in collaboration with the family's existing Part C early intervention provider. And the reason we do that is to help establish that continuity of care for the target family, and also to increase the capacity of the early intervention provider to serve other children on their caseload who may also be diagnosed with autism or have children with other relevant behavior concerns. So our follow-up services emphasize evidence-based intervention founded on the principles of applied behavior analysis and focus on one of 5 topic-specific manualized curriculum modules that we developed here at TRIAD. Those include addressing challenging behaviors, basics of communication, developing social and play skills, beginning toilet training, and addressing sleep concerns. All of these modules are available in print and as a series of brief online trainings. They're also available in Spanish in print, and we're currently working on having the online modules translated into Spanish as well. Additionally, each of these curriculum has a companion provider guide. They were developed to support providers' independent use of the curriculum modules with the families they serve. So to date, we've primarily served Middle and West Tennessee regions of our state, and our model looks a little bit like this. So the families are connected to our program through a referral from TIS for that evaluation that Jeff just discussed. And then following that appointment, a TRIAD consultant connects with the caregiver and the family's early intervention provider to gather additional information on child concerns and to develop a draft plan for intervention. The family then receives 6 ongoing follow-up visits, follow-up visits focusing on coaching caregivers to use strategies that match the needs of the child, are relatively simple to implement, and can be embedded into everyday routines and activities. To the extent possible, these sessions are done in collaboration with the family's early intervention provider. Then once the 6 visits are over, our consultants remain available to support the family's early intervention provider and the family. And this helps us to help the provider implement another curriculum when the family is ready to move on to another topic. So as mentioned previously, prior to COVID, everything was offered through a combination of in-person or telepractice. So we were fortunate to have developed and studied telemedicine prior to the COVID-19 pandemic. As a result of this, by March of 2020, we were already beginning to understand the potential of telemedicine, and our families and community partners were beginning to see the benefits of it as well. So the shift to providing services exclusively via telemedicine provided us with an opportunity to evaluate outcomes across service delivery models. I just want to share a little bit of data with you. When we shifted, it was halfway through our year. So half of our families ended up having our in-person typical model, and then half of them ended up having our telemed only model. And then there was a few there in the middle that received half and half. So we have these 3 distinct groups, and the numbers here reflect how many of those families had complete data sets for us to analyze. So to assess caregiver satisfaction with services, we use a 14-item questionnaire that includes items related to satisfaction with the service model, our consultants, the impact of the services on themselves, and the impact of the services on their children. Our caregivers reported high levels of satisfaction across each of these components, and we didn't find any significant differences in caregiver satisfaction between treatment groups. Caregivers consistently rated the consultant understood and addressed our needs highly, that the consultant provided useful recommendations, and that they were pleased with the outcomes of the resources for their family. We also give caregivers and providers a 14-item satisfaction questionnaire. On this measure, both caregivers and providers provide high levels of satisfaction with the intervention model, the consultant, and the outcomes of service. One difference did emerge between our provider groups, where early intervention providers who participated in the telemedicine only model gave higher ratings of satisfaction across intervention, consultant, and outcome items. We hypothesize that this may be because these providers were able to attend the telemedicine visits more frequently and with more ease than those in other groups. And it's also possible that they found our service even more valuable during a time when they personally changed. Their practice was personally changed by the shift to all online services. So we sent a separate survey regarding satisfaction specifically with the telemedicine services to caregivers who completed at least one telemedicine session with us. The majority of caregivers reported feeling that telemedicine consult was engaged during the visit, that they were able to effectively communicate their concerns to the consultant, and that the telemedicine visit was as private as an in-person visit. Qualitatively, caregivers commented that telemedicine visits were convenient and provided an opportunity to continue services during the COVID pandemic. So following the success of our Tele-Diagnostic Model in West Tennessee, we were anxious to develop a model to support our neighbors in East Tennessee. And that is where Jamie and Karen and Katie are from. They're in East Tennessee. So in West Tennessee, like Jeff mentioned, we are fortunate to have 2 TRIAD consultants who live in the area and were available to support families and service providers in person or via telepractice. So for East Tennessee, we wanted to think about a model that would not require any extra people on the ground, but instead would utilize the professionals already working with families on a regular basis. So to support this, we developed TRIAD's Tennessee Early Assessment and Mentorship Opportunity Program, and initiated partnerships with a few early intervention resource agencies in East Tennessee. So Emory Valley is one of those agencies. These agencies employ the early interventionists that serve the families through TIS. So each agency identified 3 to 4 early interventionists to participate in a curriculum around early identification and treatment. So the initial training for these early interventionists consisted of providing access to online STAT training modules and engaging in a didactic STAT webinar. The intended model was to have the developmental therapists implement the STAT while the TRIAD psychologists observed through telehealth, similar to what we were doing in West Tennessee. This changed when in-person visits were suspended due to COVID-19, and the model was adapted to a home-based telediagnostic consultation with a psychologist using the Tele-ASD PEDS that Jeff talked about, and the developmental therapist was on the call to observe. Ongoing support and training are provided to the developmental therapists through a monthly virtual professional learning community led by BCBA. So we currently have about 20 early intervention providers that participate in our monthly PLC. Katie and Karen are two of those, and they can tell you a little bit more about what they've gained from it. But the goal of the PLC is to be able to go through our curriculum session by session to ensure that the developmental therapists feel confident using them independently with the families that they serve. The participants are also able to share their work experiences with the group and learn from each other. And they're also encouraged to share information that they learn back with others at their agency. So as a result of Team Opportunity, in addition to the 2 original contracted sites, we now have 6 early intervention agencies collaborating with us to provide telediagnostic services to the families they serve. In the past year, we've provided 46 families in East Tennessee with telediagnostic evaluations, and 14 of those families and their developmental therapists also participated in our follow-up services. So we gathered a little bit of data on this program as well. And our preliminary data is very promising. We asked the Team Op early intervention providers to give us some feedback on their experiences with the Tele-Diagnostic Evaluation, and their feedback was very positive. They have an average rating of 4.78 on a scale of 1 to 5. Providers cited specific benefits to families like shorter wait and travel times and allowing the child to be seen in his or her natural environment, and also being able to see what having the provider be able to see what the evaluator sees. Caregivers also completed satisfaction surveys about the telediagnostic experience. They report very high satisfaction with the process with an average rating of 5 across all areas on a scale of 1 to 5. Additionally, they report that the telediagnostic evaluation saved them an average of 4.4 hours of round trip travel time. Caregivers and providers that participated in the 6 follow-up visits through our telehealth also completed surveys about their satisfaction with those visits. And as you can see from the table, responses were consistently high from caregivers and providers. So moving forward, we plan to return to in-person services for families that are less likely to benefit from telemedicine due to either technical issues or complicated behavior profiles. We'd also like to replicate our program to other intervention agencies across Tennessee with an end goal of having partners accessible to all TIS families. And we're continuing to develop and pilot strategies for getting families the information and support they need following a diagnostic evaluation for ASD. Currently, we're piloting a model that includes 2 brief follow-up consults with the evaluating psychologist with access to tip sheets associated and video examples that can be easily accessed through a QR code. So I want to make sure we have time. We're super grateful. We're joined here today by 2 of our developmental therapists that are part of Team Op, Katie Wood and Karen Olson. And they're going to share with us how their participation in the program has benefited their practice as early intervention providers and answer any questions y'all might have for them. And then we also are fortunate to have Jamie Sharp joining us today. She and her son participated in a telediagnostic evaluation, as well as our follow-up services with Katie in one of our TRIAD consults. So I'm going to turn it over to them. If Katie and Karen, if y'all want to talk a little bit about your involvement in going through STAT training and then that kind of being put on hold for COVID and being able to now just observe the telediagnostic evaluations.
Sure. So when we did start, it was, we did study the stat and what the stat was. We took online training for what that looked like, and they do testing on there, and we got certified in that area. And then, like Mary said, COVID happened and everything changed. But because it was so already just easily mended together that we were able to do that. I love being part of the evaluations because I do get to see exactly what they see. I get to also, talk with the parent as someone they know already to kind of guide them through that process and be extra support for them. And I think it is important when the child gets a diagnosis to be there to still follow up with them and use the curriculums in that way. So Katie.
But I agree. Thanks, Karen. I agree with everything Karen said. We obviously prepared to do it a different way, but changed that due to COVID, and it has really gone smoothly as far. Karen, would you agree? It's gone really, really smoothly for myself and my families.
And I think my parents really enjoyed being an active participant in the evaluation, because it is hard to go somewhere strange where your child doesn't know anybody and your child doesn't know the person they're working with, and it's, strange toys or interesting toys. This way they're in their own home, they're comfortable, they're with the people they love the most in the world. And I think it just takes that stress off the parents. Because I think a parent, Jamie, you might know this, going somewhere strange and unusual, you're worried, how do I get there? What time do I get there? Who's going to babysit my other children?
Right.
And I think all that worry's gone.
Yeah, it absolutely is. And it's interesting how you talked about, you're at your house and you're playing with your toys, because my son has done evaluations for different programs like pre-K and things like that. And you're sitting there filling out paperwork and you're like trying to pay attention and trying to see what they're doing, but you have to answer all these pages and you feel torn because you want to do the paperwork and be accurate, but you also want to try to help. He'll do that. Let me just help you do that, and things like this. So it was nice to be able to be, at your house and use your toys and get the guidance from Katie and Amy to know, like, what do I do next? And if he's not responding, what should I do? And so it definitely put me at ease.
Good. Katie and Karen, did y'all notice any difference in your enrollment when everything switched from in-person to online?
I reached out to our supervisor, Anna McMillan, and from Emory Valley, and she did send me the numbers. So February 2020, before COVID happened, we were at 529 children that were being seen. COVID hit in March is when they pulled us out of the homes, and the number just slightly dropped to 510 for that month. Our program was able to get a Zoom account set up for us, and we were back at 85% attendance by April of 2020. So I think our early interventionists really got on it and got it, picked it up, worked with technology, worked with parents and technology. I mean, it was new for everyone. And then Katie and I were talking about this. What really made it great for everyone is, at first we could only do Zoom and Zoom only. But then when they changed it, that we could do other platforms such as WhatsApp, Google Duo, Facebook video chat, and FaceTime, that made it even more accessible to more people. During that time, if people did not have smartphones or apps or anything, we were able to do phone consults and use that as part of our visit with them also. So it wasn't like, we're leaving you all abandoned, COVID happened. We were able to reach out with them in some way, some shape or form to give them the support they needed.
Jamie, I would love to hear your perspective as a parent of going from in-person early intervention services to the telehealth.
Yeah, I have two sons on the spectrum, and my first son, everything he went through early intervention wise was in home. So we had, speech and developmental therapists, and everything was at the house. And then a couple of years later, my second son hits that age, and we noticed there's some delays, and so we actually joined the program in July or August of last year. So it was, fully immersed with the telehealth at that point. But having gone through both, right, only doing in home versus only doing telehealth, it really is the same. There's not a difference in the quality of tips or care or guidance that you're getting. It really is exactly how it would be in your home. The only difference is you're the one, like you're the therapist in that moment. So you're the one like, no, we're going to sit down and we're going to do this activity. So you have a little bit more of a hands-on approach with telehealth, but you're not alone in that. Katie guides me through things that I can try. And if something isn't working, then maybe, let's take a break and try that the next visit. But from my perspective, it's been the exact same, the guidance, the tips, the feedback, and actually there's more resources available to telehealth. I feel like the programs that you mentioned for like follow-up visits and like the videos that are on the TRIAD site, I go in there and I just watch some of them. I told Katie, I was like, I watched the challenging behavior ones, and it's amazing, like some of the tips that are in there. So I do think it's a little bit more resources available to you with the telehealth.
That's great. And Katie and Jamie, y'all worked with, I think, Kathleen Simcoe, one of our TRIAD consultants, for those follow-up services. Can you share a little bit about what she did with you guys?
Absolutely. And Kathleen, she did 6 visits, and then Jamie, I want to say after the 6, hasn't she joined us for a couple more, like once a month?
Once a month, yeah. She's been joining pretty regularly, yeah.
Yeah, and so it has been a tremendous help to me with this being, a brand new pilot project, and I was able to go through the modules, but it's a lot of information, and the curriculums are a lot of information again. And so Kathleen has helped me kind of go through the curriculums and pull out some of the, important resources and tip sheets to help guide us through what's going on with their child, whether it be a challenging behavior, whether, we want to focus on communication for 6 weeks, whether we want to, it's been awesome because you can start with one curriculum, and then if you have something, if the parent has a concern about something going on with their child, you can shift gears and move to a different curriculum. So Kathleen, I feel like, really helped guide us through the modules and curriculums. Would you agree, Jamie?
Yeah, absolutely. She was able to show us, how the different modules work in different facets of that. And then there would be, for the 6 initial visits, we would, okay, say this next visit, you're going to do this module, and then we'll regroup and talk about it. So it was very structured, which, is appreciative. Like I'm a planner. I like to know what's going on. And so I would say, okay, I'm going to do my homework by this day. And then, so when we meet on Tuesday, I'm prepared and ready to kind of, talk about what I learned from that module. But on the flip side of that, it's nice to just sometimes not have it so structured. Like, if I did it and I didn't have a lot of questions and, we didn't need to spend a lot of time on it, Kathleen and Katie were very quick to just adjust and say, okay, well, what's been going on? Is there anything new that's popped up with your son? And, so it was nice to be able to have that flexibility, I think.
Mm-hmm. And what I also like with the consults coming in also, I think they take that first meeting and they really get to know like the parent and the family and find out where your priorities are. So it's not like coming in with a whole agenda set. It's like, well, let me talk to Jamie and find out, what is going on? Where are her priorities for her son? So I think my parents that have participated in that really like that personalization of the consult visits.
Great. I haven't looked to see if any questions have popped up in chat. I wanted to open this up to any questions from others. Paige, are there any other? Go ahead, Jeff.
No, if there are others, sorry, I don't want to cut anybody off if there's questions from the group, but I mean, it's just, so it's really nice hearing y'all's perspective, especially you, Jamie, and just, you know, being brave throughout the process and kind of trusting different team members as we swirl around over the internet, trying, and I think, you know, from the provider perspective, the uncomfortable area that we have is if we are providing services over telehealth, at what point when we hang up the phone or hang up Zoom, is there this, like, you know, what are parents feeling and doing afterwards, right? And so our fear was this system's really only going to work if we have a team member or some close connection with our developmental therapist or a similar provider to be there for parents when we hang up their phone and what did he just say? And he gave me like 90 things to do. And, you know, it was overwhelming to hear about a diagnosis, but then he said, here's 30 things you have to do and you have to do them tonight. And so it's that it feels like we're piling it on for parents during a very overwhelming time. And I think hearing y'all's connection, Katie and Karen, to your parents, right? And how, you know, the system wouldn't nearly work as well if we didn't have that close connection with y'all. And you know, we call it like the warm handoff, but some are warmer than others, right? And I think it's just crucial to the process of both, Mary, when you were in person, having you there with parents to say, you know, this is what Jeff said, this is what Jeff means, and this is what he really means by next steps. But also here are the people that are actually going to do it. And actually you already know one of them, right? Because they've been working with your family all along. And so we don't often, outside of the, you know, we get data back, but we don't get that real perspective. And so it's nice to kind of hear that side of things, because we never want to feel like we're putting families in like a lost position once we hang up the Zoom, right? Especially since I'm not in the region that you all live in, right? As the psychologist. So it's really nice having those regional connections, and hopefully we're doing our best to continue and make that sustainable. And all that to say, were there you know, times, I guess this might go to Katie and Karen or Jamie, if you have recommendations for other parents, where if it's not as smooth, right? If that connection, either provider side or family side, just wasn't as smooth. What tactics or strategies have you all used? I mean, you know, one thing, I'm talking a lot for asking a question here.
So Katie and I and our other early interventionists, we just had to present to our Emory Valley Center. And one thing we were talking about is when we send our children to these other providers to be, you know, evaluated for autism, we know nothing of what's going on. We don't know when it is. We don't know if the parent showed up. We don't know what the diagnosis was, you know, and we don't know how the child behaved. We are so blindsided by it almost. And this, it's like, okay, we can just streamline, keep going, because we know all the pieces already. We know what the child did. We know what questions the parent had. And I think that just makes it so much better for us helping the parents. So Jamie, I don't know how your first son was evaluated versus your second one. Do you have differences to compare in how that was done?
Well, so my first son actually didn't get a medical diagnosis of autism until I actually went through TRIAD. Amy is the person who did the evaluation for my youngest. And during that discussion, and it really is like, you do make good connections with these folks, even though you're on telehealth. Like if you're open to the process and open to everything that's going on, and you really do share genuinely, you're going to build that relationship and you're going to build trust with them. But, you know, as we went through it with my youngest, you know, Katie was there, Kathleen was there, Amy was there, I was there. So I had like a team of people, you know, helping me do the evaluation. But during it, you know, I mentioned to her, my son, my oldest is, you know, from a educational standpoint, the school system had said, you know, we think he's autistic and he can qualify for services through the school, but my pediatrician was not as open to pursuing it based on his age at the time. So I just kind of let it go and didn't push really hard. And Amy was so nice to say, you know, if you ever want me to evaluate him, just let me know a day and a time. We can get together and we can do that. And so it was really great that she was just so willing to take the time out of her day to, you know, reach out to my other son who, you know, all of the things that we were talking about were focused on one and not the other, but it was nice for her to offer it and to do it. Like we did it, and we met up a month later and we did it through Zoom, and she's like, yes, he's autistic as well. And so it was just nice to be able to have someone you could put that trust in, and know that, you know, it's a good thing. It's coming from a good place. And so it worked out really nicely for us. And, you know, I think he's been evaluated. My eldest has been evaluated like through the school system and things like that. And that was kind of the area in which I couldn't participate in the evaluation because there was so much paperwork to do, and I could like hear him not cooperating and like crying and not doing what they wanted. And I'm like, oh gosh, just let me go over there, but I got to do this paperwork. And so you feel torn in that sort of realm, or that type of an evaluation. But with the telehealth, you know, it was really play-based, and it was like, okay, let's build some blocks and let's do that together, and yay, we did it. And then we would switch to a different activity like drawing, and, you know, he didn't want to participate, or he just wanted to chew on the pencil. And, you know, so we would go with the flow of him, and it worked out really nicely because we were in our own house and we were using our own toys. And so, you know, I knew he wasn't going to love this toy, but if this is the goal we're trying to get out of it, let's switch to this one because he really likes this one. We might be able to get him to say go with this toy.
One thing I wanted to add is I had, Mary, do I have a second to add something? Okay. One thing I wanted to add was that for some parents, you know, that for a lot of parents, this is a scary process. And it has been wonderful for me to be able to say to parents, you know, I have been a part of 10 to 12 evaluations with Amy Nicholson now. You know, I've spent 20 hours with her, you know, with families, and just to be able to tell my families, you know, how the whole process works. And I think that has really comforted parents to know that. Whereas if I just sent them to be evaluated by another provider that I don't know, that provider, I'm sure, is amazing at what they do, but I think it gives a whole nother level of comfort to my families. Would you agree with that, Jamie?
Yeah, absolutely. I mean, we were set up for how it was going to work and what was going to be asked and how the structure of the session would go. And so I knew exactly what to anticipate and what would take place. And even more so when she, you know, evaluated my eldest, I was like, okay, I did this once before, I can do this again, you know? But, you know, when I had to take my oldest for the evaluation through the school system, it was somewhere I'd never been. I tried to GPS it out and figure out, like, where do I park? And I parked in the wrong spot and I went in the wrong door. So then I had to figure out what the right door was. And I'd never been through any of it. So it was all very like overwhelming. And, you know, they can try to prepare you for what's going to happen, but when you're going somewhere alone, it is, you know, you are alone. And so there is some fears and doubts that can creep in. But, you know, the telehealth, like I said, I had Amy and Katie and Kathleen and me. And so it didn't feel like you were alone. You felt like you had a team of people there to help support you and guide you through the process, which was really nice.
And I think when it's people, you know, you can ask any question, right? You don't have to be like, oh gosh, what are they going to think if I call and ask this question? Or, oh gosh, am I bothering them to ask this question? And, you know, Katie's always there for you. And when Kathleen's on, you know, Katie can even email her a question. And like Amy says, if you have a question today, tomorrow, a year from now, reach out to me. Jeff, I'm sure you probably say the same thing to your families too, but it's just nice to know that, you know, no question is not okay. Any question is fine, and there's a team of people ready to answer your question for you.
And Mary, I also just kudos to all of you, Kathleen, that I feel like because I spend, once a month with you guys, kind of going through the curriculums, I feel so comfortable reaching out if I have any question that I'm really unsure about, that a family might be struggling with giving their child medication. And it's just awesome to be able to send you guys an email and say, hey, have you ever dealt with this before? Do you have any ideas for me on how to help this family? It's just been incredible. So thank you.
You're welcome. And I appreciate y'all's participation. Like I said, Karen and Katie both participate in our monthly PLC, our professional learning community, and really contribute a lot to that. And I think you guys even went back and shared information with the rest of your colleagues. I believe y'all did a presentation for them. So they're taking the information that we're sharing with them and sharing it further, which is exactly, the goal of our program, is really to build up the capacity of the early interventionists who are already in the homes to be able to provide these services, whereas we're backup, right? So that you feel confident doing it, but if you have a question, you can reach out to us. So that's great. Were there any other questions? I don't see anything in the chat.
I think, oh, sorry, Paige. Is any questions so far? One thing that I had, and hopefully over the next year, as in-person visits are again allowed, what are you all looking forward to? I think in terms of in-person visits will give us a sense of kind of the difference, but also what do you hope sticks around in terms? I mean, I'm always, especially during COVID, thinking about where are the silver linings to all of this, right? And I think you three definitely are silver linings in talking about a lot of those things in our ability to work with families for sure. So I guess maybe it's better to say, as we go back to in-person, like what are those kind of silver linings about this telehealth experience that you hope stick around, or that you've learned for either professionally or as a parent?
And I do think we might have a question from Patricia.
Yes, can you hear me?
Oh, yeah.
Yeah. Hey, it's Pat Purcell. I am the medical director for the Office for Children with Special Healthcare Needs in Louisville, Kentucky. And we have been doing telehealth also. We had a hybrid model, and then we morphed into a total telemedicine model. And how are you all working on and looking at repeat visits? Because that's one of the conundrums that I find in terms of how many times do I feel comfortable that a patient can be seen on a telehealth visit before they would need, and I put that in italics, to be seen in a face-to-face in-person visit. Are you all monitoring that? Do you have some sort of perspective on that, please?
Just, I guess we'll need a little bit of clarification. So there's kind of two different services, right? One would be the diagnostic piece, and one would be the follow-up piece.
Yes.
I think, and are you talking about both, or are you talking about for if we need clarification diagnostically, or if you feel like if a provider feels like they just need to get with the family and with the kid to do more modeling strategies?
I think a little, actually, I think it would be both, because even with the modeling strategy, is there a time where a therapist would want to see the child and the parent in person, or do they feel comfortable that they can continue to provide the services over the telehealth visit?
I think that's a great question. And Karen, you were going to talk, so let me talk less. Go.
Our agency, Emory Valley, we use the family coaching model, and that is building the capacity of parents. So it's not me coming in doing things to show them, but it's like asking the parents questions, guiding the parents through, what they think next steps for their kids can be. And that makes the parents, they feel more involved and they feel more ownership over the therapy that they're giving their children. Because I'm just 1 hour a week. It's the other 23 hours in a day that matter most for that family. And I think that parent coaching model has been so helpful in all this, because I am part of those early intervention sites on Facebook, whatnot, and everyone's like, what are you doing about this? What about this? What about that? And for us, I never had that panicked, because it was, when I go in people's houses, I'm not the one touching the child. I'm not the one doing, feeding the child and helping them sign more. I'm coaching the parent on how to do those things. And that model really helped. As of now, our agency in Tennessee, we are not doing face-to-face visit at this time.
And to piggyback on what Karen said, Pat, I do have some families, everybody has a different learning style. And I have a new family that I acquired about a month ago. And, I'm using coaching strategies, and I'll observe the mother do a strategy with her child. But I did have this mother recently say to me, I just wish you could come in my home. And so those are the families that I'm like, really, it's her learning style. She wants me to model these strategies for her. But thank goodness for Vanderbilt and TRIAD, I said to the mom, how would you like to start watching some of these modules together? I had directed her to the website, and that she, for whatever reason, I believe it was a challenge for her to kind of watch the videos on her own. So what we decided to do was watch parts of the modules during our visits, and then kind of talk about and try these strategies towards the end of our visit. So that's what we're doing right now until I can get into the home. But that it is a challenge, I think, for certain learning styles, the telehealth model.
Well, I appreciate that. I'm sure you're building her confidence, or the parents' confidence, by being there and doing that.
Absolutely. Does anyone else have anything to add to that?
I mean, I would say after having, a year of services for my eldest in person, and then, going on a year now of telehealth, I did have a little bit of experience of, the modeling aspect of it. So kind of knew, how to sound more, and how to wait that period of time to see if I can get a response out of my child. So I had a little bit of education prior to that, but I do think the videos that are on the website are crucial, because not everybody's going to be able just to read through it and understand what they need to do. Sometimes it is that visual aspect, and it really helps solidify for the parent, okay, this is what they mean by antecedent, and this is what they mean by waiting, and this is what they mean by challenging behaviors. And, as you go through and you watch the modules, they'll break them down afterwards too, which is good. So if you don't see it right away, it's okay, because it'll go back and kind of tell you what that was. And there's little knowledge checks in it to help you understand if you're really grasping the information, and if you're not, they'll tell you where you went wrong, and it kind of helps you digest it and kind of learn it a little bit better.
I think we're running out of time. I want to make sure you can see where they're, the triad.vumc.org, you can access those modules that they're talking about. Basically, we have video examples within the curriculum of parents doing some of these strategies that we're talking about. So if you're interested in finding those, they are on our website, and they're accessible to anybody. So.
Awesome. Well, thank you all so much. That was really wonderful. And Mary, do you mind? I just want to pull up one slide really, really quick. So let's see. Just wanted to thank everybody, and remind you that we will share the recording and the slides with the links that were just mentioned, as well as contact information if you'd like to have more conversations. This is really wonderful, and this is exactly how we envision the coffee talks going. So thank you all for the presentations and discussion. So we just wanted to let everyone know that we do have 3 more coffee talks for the remaining Wednesdays in April, and you can register for them. I just dropped the link in the chat box for you, and we're really excited because the one next week and the one after that will feature and be led by autistic advocates and scholars in the field. And then our one wrapping up Autism Acceptance Month is called Celebrating Neurodiversity. We'll hear from a parent who's going to share her experience advocating and helping her child and now adolescent find his voice. And then we will do some action-based breakouts where we'll be having some great conversations led by autistic advocates around how we all can lift up the voice of autistic individuals in our work. So really looking forward to that and hope to see all of you there. Thank you to Jeff, Mary, Katie, Karen, Jamie. Really, really appreciate it. And yeah, we'll see you all hopefully next week. Thank you all so much. Bye.